Hello. Again, I am back with some healthy talking discussion about the problems of kids, health problems of kids, like difficulty breathing today and wheeze. It is extremely scary if you see your child short of breath, isn't it? And use your instinct if your child appears well and their breathing difficulty improves after a short period. There is nothing to be worried much. Which is extremely common in young children and is often triggered by viral infection. And post preschool children with which do not have asthma. Child under 2 years old breathing difficulty may have bronchiolitis, which is also a very common condition, starts as runny nose and cough, but that breathing may get worse over next 2 to 3 days. If your child is struggling to breathe and they need to be urgently seen by a medical practitioner, are likely to need treatment. If your child has croup like hoarse voice, barking cough, noisy breathing, they will also need to be seen by a medical practitioner. Most chest infections are caused by virus and do not usually need treatment with antibiotic. Now, most important thing, you have to understand your child's some red flag sign, which is very dangerous for them. So you have to look if your child has blue lips, has pause in their breathing, which we call apneas, and has irregular breathing pattern and starts grunting. A harsh breathing or noise as the breath is called stridor, present in all the time, even when they are not upset. Too breathless to talk, eat, or drink, is very pale or mottled, feels abnormally cold to touch, is extremely agitated, crying inconsolably despite distraction, confused or very lethargic, difficult to awake, has a rash that does not disappear with pressure, if you pressure by a glass. So in that case, you have to go to emergency, and also you can phone 999. Now, also you have to look for some of the signs that not that danger, but also you have to be worried, is we call amber signs, like if a child has labored rapid breathing and working hard like that to breathe and drawing in the muscles below their lower lip and its necks, like here you can see on in between ribs, you can see that we call recession, and harsh breath noise as they breathe in stridor present only when they are upset. Seems dehydrated, like sunken eye, very drowsy, not passing urine for 12 hours. Drowsy means excessively sleepy or irritable, unable to settle them with toy, with TV, with food, or even picking up, especially if remains drowsy or irritable despite their fever coming down. Has extreme shivering and complaining of muscle pain. In 3 to 6 month age, temperature of 39 degree or 102.2 degree Fahrenheit or above, but fever is common in babies up to 2 days after they receive vaccination. Continues to have fever 38 degree or above, centigrade or above, for more than 5 days, and is it getting worse if you are worried. You have to ring your GP surgery or call NHS if you are in UK, NHS 111. If symptoms persist for 40 hours or more and you have not able to speak to either member of staff from GP practice on 111, recheck the child has not developed any dread features. So now none of these grades are present. Make sure that then your child is in green zone. Make sure child stays well hydrated by offering them lots of fluids. Closely monitor them any sign of deterioration, like I already mentioned, red and amber feature. Additional also, of course, you continue to provide child care at home. Still, if you are concerned, you can talk with health visitor, you can talk with local pharmacist, you can talk with the NHS 111. Children and young who are unwell and have a high temperature should stay at home. They can go back to school, college, and childcare when they are no longer has high temperature and they are well enough to attend. Now, what should you do? Child is interacting normally, able to drink, watch them closely at home. If child feeding is not feeding, it is usually the dog cannot feed, sufficiently. So you should offer a small amount of feed frequently. If they become more breathless, start to struggle to drink, you need to see urgently by medical practitioner, called your GP surgery or NHS 111. If your child has a fever and the breathing has become more rapid, then should try to lower their temperature with paracetamol. Now, how long your child's symptoms? Although child coughs can last for 2-3 weeks, should not be breathless or wheezy for more than 3 to 4 days. So basically, it is very important to look up after them. Now, you can seek advice in non-urgent cases, local pharmacist. And of course, if there is a red or amber feature, I told you, amber feature you call the GP out of our appointment also you can get, or also NHS 111 can help, and red features 999 or any department. Of course, that they are very, they can look after your child. Of course, you have to self-care. You can treat your child's minor illness injuries at home. So you can, you can give the support by yourself, but you should keep an eye on your child. Okay. So this I think help a little bit about how to manage a child with who are breathless or who has wheeze. Um, we will again come with another topic next week. Bye for today.